Oftentimes, when we talk of painkillers, people think they are just the artificial ones that are available, such as paracetamol and others. But did you also know that we have natural painkillers in our brains? The answer is yes. We do have natural painkillers in our brains, and that's what we are going to discuss today. If you are new here, kindly subscribe to this channel for me. This is Time with Nurse Joycelyn. I talk about nursing and also offer health tips for a healthy lifestyle. Thank you all for joining me today. Stay tuned. The natural painkillers produced by the brain are the endorphins, enkephalins, dynorphins, beta endorphins, and metenkephalins. They are all produced for special purposes, and we are going to know about it today. Endorphins are natural painkillers that promote feelings of pleasure and well-being. They are released purposely in response to pain, stress, and pleasure. So that is the purpose for which endorphins are being released. Just like the endorphins, dynorphins and beta endorphins are also released in response to stress, pain, and pleasure. Enkephalins are the natural painkillers that work by binding to opioid receptors in the brain and also the spinal cord. Don't worry, you get to know what opioids are very soon. Metenkephalins are also released in response to pain and stress. Artificial painkillers, or what we medically call analgesics, are a class of medications that are used to manage pain or that are prescribed in the management of pain. Now, at what point do we consider these type of medications? At what point do we consider artificial painkillers? Also, when natural methods of pain management like ice application, compression, or elevation have proven futile, or even when therapies such as acupuncture or massage are not giving adequate relief. Now, let's talk about classes of painkillers. I mean the artificial painkillers or analgesics. We have one, opioid analgesics. I told you earlier on that you get to know what opioids are. Opioid analgesics are derived from the plant opium. They work by binding to opioid receptors in the brain and the spinal cord, and they are used to treat moderate to severe pain. Examples of opioid analgesics are morphine, pethidine, oxycodone, and etc. We also have non-opioid analgesics, and these ones are used to treat mild to moderate pain. They work by also blocking the production of pain-causing chemicals in the body. Examples of non-opioid analgesics are paracetamol, aspirin, and ibuprofen. We also have muscle relaxants that are prescribed for muscle spasms in pain. Examples are baclofen and carisoprodol. There's also another class called corticosteroids. Corticosteroids are prescribed for inflammation and pain that are caused by conditions such as arthritis. Examples of corticosteroids are prednisolone and dexamethasone. We also have anticonvulsants such as carbamazepine and gabapentin that are prescribed to treat nerve pain caused by conditions such as shingles and diabetes. There are also topical analgesics that are applied directly to the skin to relieve pain. Examples are lidocaine and diclofenac gel. Remember also that painkillers have significant effects on the liver and the kidneys, especially when taken excessively. So always use them as directed, that is following the right dosage and duration of use. You also try and stay hydrated when you are on them by drinking plenty of water to flush out toxins in order that you reduce the risk of kidney damage. Avoid mixing painkillers, and also remember to consult a healthcare professional before taking them, especially if you have pre-existing liver or kidney disease.